Hello guys, welcome to DOPAMIND. I'm Dr. Amrita. As you all know that learning medical terminology is just like the way we learn another language. I'm here to tell you about certain basic medical terms which will be helpful for you in your future. So let's check out those terms. Our first term is epi or peri. That means around. As an example, we could say that epidermis. Epidermis is the layer which is around the dermis. Or we could say like pericardium. Pericardium is the outer layer of heart or cardio. Coming to the next term, which is endo. Endo means inside. Have you heard about this term? Endocytosis. What do you mean by endocytosis? Endocytosis is a process by which the cell engages certain substances by forming vesicles inside the cellular membrane. So, inside. And the term exo. As an example, we could say exocytosis. Exocytosis is the process by which the cell will eject or release certain substances to the outer surface of the cell membrane. Okay. Our next term is ether. Ether means between. As an example, you could say intercellular. That means movement of molecules in between the cells. What do we mean by intra? Intra means within or inside. If you are saying like, have you heard about intravenous administration of a drug? As an example, we say that means we are injecting the drug directly inside into the vein. Okay? Venous means vein. So, intravenous. Now the term medio. Medio means middle. Okay. Guys, the term trans. Trans means across or through. We could say like transcranial. That means through the cranium. And what about the term juxta? Juxta means next to. You all might have heard juxtaglomerular apparatus. What that means next to the glomerular apparatus. Now the term para. Para means nearby, which is the gland which is nearby located to thyroid. We can say parathyroid gland. Guys, there are another two very important terms that we have to know. They are proximal and distal. What do we mean by proximal? A structure that is closer to the center of the body, we can call it as proximal. For example, we will take femur bone and the proximal end of femur bone is attached to the hip joint. Okay? Whereas the distal part, the distal end of the femur is attached to the knee joint. Is that clear? Guys, let's move into another set of terms that are fatty. Fatty means fast. If our heart beats fast, we can call the condition as tachycardia. Similarly, if our heart beats slow, we call the condition as bradycardia. We do have the prefixes like at and ad. Ad means to move away. For example, if I am saying like, this is my thought, right? I have to move this thought away from other fingers. So, I call this process as what? Abduction. So, I am abducting my thumb. Whereas, I need my thumb to come closer to other fingers. Like this. If I am moving my thumb closer to other fingers, I can call the process as adduction. See, now I am abducting my thumb, and now I am adducting my thumb to the other finger. Coming to another set of terms like hyper. Hyper means increased. As an example, we will say like hypercapnia. Guys, capnia means carbon dioxide level. Okay, so increased carbon dioxide level in the body, we can call it as hypercapnia. And the condition where oxygen level in our body is decreased, we call it as hypoxia. So hypo means decreased level or amount. Another term is iso or equi. That means same or equal. We heard about isothermal or we heard about equilibrium, etc. Right? And another term is U. U means what? Normal. If we call a patient which has a normal thyroid condition or normal thyroid, we can call patient with euthyroid condition. That means normal thyroid. Okay? U means normal. Another terms are macro and micro, which is very familiar term. Macro, big, micro, small. We heard about macromolecules, micromolecules, right? Guys, everybody like colors. There are certain medical terms which are in relation to colors, like chromo or chromato, which means color. We will say opaque, that means non-transparent. Lucent means transparent. These two terms which we frequently use in radiology. And there are terms like erythro, rubro, eosino, rod. All these terms refers to the color red, like erythrocyte, red blood cell, and rubra, we will say this is like rubra vera, and eosinophil, rhodopsin pigment, right? These all refers to the red color. And what is this? Chlorophyll, or about chlorophyll, right? Green pigment, which means green. Also, there are terms that start with cyano. Cyano means blue color. You heard about the term cyanosis, right? Sclerosis or carotene refers to color orange. We heard about liver cirrhosis, right? Well, the coloration happens orange. And leuco, albino, cat. These refers to the color violet. Okay. We heard about WBC, which is leukocyte, white blood cells, albino, and cat. Cat, for example, we could say like the disease candidiasis, where the whitish form discharges is formed, right? So, cat. And the term flavo or giotto or xantho or lude. These refers to which color? These refers to yellow color. Flavo, like riboflavin, jaundice. We heard about xanthophyll pigment, which is yellow in color, and the corpus luteum, right? That the lude means yellow color. Here the corpus luteum, the color is yellow. We also do have terms like rochio, means pink in color, chrysum means golden in color, and we do have purpura or porphyro, that refers to purple color, and melano, everybody know melano, that refers to black-eyed color. And melano refers to black-eyed color. There are certain terms which we use in basis of numbers, like uni or mono, which means one. You could say like unicellular or monocyte. Di or bi, which means two. Psi means three. We heard about trisomy, right? Trisomy with 3 chromosomal numbers. And quadri or tetra, 4. Deca means 10. Nulli means lacking. As an example, nulliparous. Have you ever thought why we use the term a or ad as a prefix? A or ad means absent or lacking. For an example, I could say anemia. See guys, anemia means anything related to blood. So, decrease in the count of blood, we can call it as, or lacking of the blood, we can call it as anemia. And another term is asystole. Asystole means what? Absence of the electrical or mechanical activity of the heart which we see in an ECG, right? We can call it as a star. The term multi. Multi means many. And what about the term pan? Pan means all. As an example, I could say pancytopenia. What do you mean by pancytopenia? Pancytopenia means decrease in the number or amount of all the cells like RBC, erythrocytes, WBC, platelets, etc. altogether decreasing in our blood. We can call that condition as pancytopenia. That means all. Poly. Poly means many or more. If we could say like polyuria. Polyuria means increased in the amount of urine produced in our body. Okay. Same, the opposite we can use it as oligouria. Oligouria means decreased amount of urine is excreted from our body. So guys, I already told you a couple of terms. Now, just to sum up the session, we will talk about these terms. For example, adrenal. Adrenal means towards, right? So, towards the kidney. Towards kidney. Melanocyte. Melano means black in color. So, cyte means cell. So, black colored cell. Chromophobia. Phobia means fear of something, right? So, chromo means color. Fear of color. And juxtarenal. Juxta means next to. Renal means kidney. So, next to the kidney. Cyanosis. Cyano means which color? Cyano means blue in color. And osis means a dysfunction or disease. And a abnormality can be called as osis, okay? So, cyanosis means blue coloration of the skin while the patient is in hypoxic condition, okay? And tachypnea. Tachy means fast. So, pnea means breathing. Fast breathing, we can call the term as tachypnea. So guys, that's all about today. And I hope you like this video. If so, please do like, subscribe and share. Also mention your comments. We will see in our next video. Thank you.